Group of Ministers reviews current status of preparedness to fight COVID-19. Percentage of cured COVID-19 patients improving day by day in the country. Several districts show zero infection. Global COVID-19 cases rise to 2,275,968 cases with more than 1,55,000 deaths. Vice President Venkaiah Naidu urges the nation's youth to come out with innovative ways to tackle the menace of coronavirus. And amidst the corona crisis, Tripura decides to create posts in 22 government degree colleges. Good evening, viewers. Welcome to the Northeast News Bulletin. This is Saraswati Singha, and now the news with the details. The group of ministers today reviewed the current status and actions for management of COVID-19. The meeting under the chairmanship of Union Health Minister Dr. Harshvardhan, the group of ministers discussed the actions taken so far, current status of social distancing measures and stringent actions taken by the centre and states to contain the spread of COVID-19. All districts have been asked to prepare and strengthen their contingency plans to combat the pandemic.
And the role that ministries can play in providing relief to the people. The guidelines to allow limited activities and measures announced by the RBI were also appreciated.
Percentage of cured patients from coronavirus is improving day by day in the country. In India, 1,992 patients have been cured so far out of the total cases of 14,378, which is 13.85%. On 25th March, when the lockdown was enforced across India, 43 patients were cured of the deadly coronavirus infection, which was 7% of the total 606 cases. Health and Family Welfare Ministry data reveals that percentage of cured patients increased by 5.22% within 1 week. On 11th April, the recovery rate was 8.63%.
फॉलो होने के बाद ही वो हॉस्पिटल सेक्टर में यूज करना चाहिए, लेकिन अगर आप देखें कि जैसे कोई सैनिटेशन वर्कर हैं या कोई और डिफरेंट लेवल पर जो वर्कर हैं, उसमें भी इन लोकल पार्लेंस वर्ड पीपीई यूज होता है, लेकिन वो ये पीपीई नहीं है. तो जिस पीपीई की हम बात कर रहे हैं वो क्लिनिकल सेटिंग वाले पीपीई.
पहले भी आपको मुद्दे पे जानकारी दे दी गई है कि कितने लोगों को क्वारंटाइन किया गया है.
Death toll rises to 480. However, as the capital of the country reports 67 novel coronavirus cases in the last 24 hours, the rate of doubling of COVID-19 cases improves to 6.2 from 3 days to lockdown 2.0. Rajasthan claims to be the first state in the country to carry out rapid testing for COVID-19. Rajasthan Health Minister Raghu Sharma claims that being first in rapid testing beginning today, 52 persons were tested and all 52 were negative.
Total confirmed cases of COVID-19 now stands at 14,378 with 480 deaths and 1,991 recoveries. 21 naval personnel test positive for COVID-19.
Global COVID-19 cases rise to 2,275,968 cases, while the death toll jumped to 1,55,519. The worst hit by the pandemic, US, with death toll crosses 37,000, while above 7,13,000 reported so far. In UK, death toll increased to 14,576, with 847 new coronavirus-related deaths recorded in hospitals yesterday. US President Donald Trump announced a $19 billion financial rescue package for American farmers. While unveiling the three-phase plan to ease lockdown, US President Donald Trump plans to reopen country's economy following the COVID-19 outbreak.
Intensive care unit.
In order to stop further infection of COVID-19, lockdown 2.0 continues. During this period, Chief Minister visits Udalguri district to look after the facilities which are being given to the public by district administration. In this visit, he monitors Udalguri Civil Hospital and the quarantine center in Sonaigaon and checks the medical facilities. After this, a meeting is held in the DC office with officials connected with emergency services. In an interview with the journalist, he appeals to the public to abide by the lockdown with dedication till 3rd May.
আপোনালোকে এই গোটেই প্ৰক্ৰিয়াটোৰ অংশীদাৰ আপোনালোকে বহু কষ্ট স্বীকাৰ কৰিছে মই আপোনালোকক ধন্যবাদ জনাইছো উদালগুৰি জিলালৈ আহিলো ইয়াত প্ৰায় 8 লাখ মানুহে বসবাস কৰে গতিকে এইখন জিলাত যাতে
A total of 34 people are COVID-19 positive in the state. Health Minister Himanta Biswa Sharma today said in a press meet that till now a total of 4,400 people's blood have been tested, out of which 34 are positive and 4,199 are negative. 167 test results are yet to be declared. 12 have been cured and discharged from hospitals and quarantine. Sharma mentioned that out of the total people infected, 89% were males while 21% are females. The group comprises of people from 18 years of age to 70 years.
We have done যদি আপোনালোকে উত্তৰ প্ৰদেশত চাই পাৰ মিলিয়ন উত্তৰ প্ৰদেশে 106টা টেষ্ট কৰিছে যাৰ
An app to app the farmers and traders during lockdown. Keeping in mind the woes of farmers and traders during lockdown, the Agricultural Ministry today launched the Kisan Rath mobile app. The app, specially designed by the National Information Centre, shall facilitate transportation of food grains and perishables. This app shall ensure farmers and traders to find transport for their agriculture and horticulture produce. Agriculture Minister Narendra Singh Tomar opined that this will greatly facilitate farmers, FPOs and cooperatives in the country to find a right from farm gates to the market. Vice President Venkaiah Naidu today through his tweet urged the country's youth to help the government and society in finding ways to combat the menace of coronavirus. He asked the youth to make the right use of their education and research to help the country and society to adopt measures to tackle the crisis situation prevailing in the country. Meghalaya records 2 more COVID-19 positive cases, count rises to a total of 10 active cases. Both cases are from the residence of the first patient, the senior medical profession from Bethany Hospital, who had succumbed to the deadly virus, while one is the helper and another is a relative.
We are ensuring that we are able to.
Manipur Chief Minister N. Biren Singh has appealed to the people of the state to indulge in some form of physical exercise every day to strengthen immunity and keep healthy during this fight against the deadly coronavirus. In a video message, N. Biren Singh said that it is an internationally accepted expert opinion that strong immune system is vital in fighting coronavirus. He also urged the public to post videos, photos of their home exercise workouts using the hashtag #StayFitWithCM Manipur and tag the handle @N. Biren Singh on Instagram. As the lockdown extended till 3rd May due to the corona pandemic, Assam government with the help of few NGOs have set up 2 camps in Dharmshala in Fancy Bazaar and Red Cross warehouse in Nunmati to ensure food security and shelter for migrant labourers in Guwahati. More than 80 migrant labourers from various states of Northeast including Assam are given shelter at Red Cross Society warehouse situated in Guwahati. They are provided with proper food 3 times a day, starting from breakfast to dinner. Blankets are also given to them.
And they could not go back to their houses. And for that reason, the Assam government, along with the help of Red Cross Society, has set up a camp here where many migrant laborers are given support here who are staying here along with the fooding and lodging. And currently I am with the in charge who is from the Red Cross Society, Mr. Munindra Sarma. I would like to ask him what exactly their preparations and how they are providing the settlement for the migrant laborers here.
Actually जो आप लोग देखा हुआ टेंट बना रेड क्रॉस टेंट बना दिया और उनका भी हमको हाइजीन के दे दिया रेड क्रॉस तरफ से उनका वो कपड़ा भी दिया ब्लैंकेट दे दिया टॉवल दे दिया मस्किटो नेट दे दिया ये सब रेड क्रॉस प्रोवाइड किया.
Assam government with the help of various NGOs have been providing every possible help to the migrant laborers who are stranded in various parts of Assam. According to the Kamrup Metro Administration, Almost 200 migrant laborers are present in the 2 camps set up in Guwahati, while others are provided with food and other essential items.
कहाँ से आए हैं और किस वजह से गुवाहाटी में और कहाँ से हैं आप?
हम लोग बेंगलुरु से आया और बेंगलुरु से गुवाहाटी में आया था 24 तारीख में। खाना पीना नहीं, हम लोग 3 दिन खाना खाया नहीं। फिर रात को 25 तारीख का रात को हम लोग पुलिस लेके आया।
तो बेंगलुरु में क्या करते थे?
बेंगलुरु में हम लोग रेस्टोरेंट में काम करते हैं।
तो वहाँ से आपको भेज दिया या आप खुद आए?
नहीं, हम लोग दुकान बंद हो गया इसलिए हम लोग आया। त्रिपुरा का है।
গুৱাহাটীতে থাকোঁ ভাড়া ঘৰত। কামত গৈছিলোঁ অলপ বৰ্ণিহাট 17 মাইল। তাতে আমি কাম কৰি থাকোঁতে লকডাউন হৈ তাৰ পৰা আমি অসম চৰকাৰৰ পৰা আমি এম্বুলেন্স মাতিছোঁ। তাৰপিছত এম্বুলেন্স যাই কিনে আমাক লৈ আহিছে। তাৰপিছত GMCত গৈছোঁ। GMCৰ পৰা আমাক টেষ্ট কৰিছে। কৰাৰ পিছত কোৱাৰেণ্টাইনত পঠাই দিছে।
Here in Guwahati, because the migrant laborers here who are settled because of they must have gone broke because everything is locked down, and here around 80 laborers along with other people who are stranded are settled here, and they are being provided with essential items. They are provided with blankets and everything, as I had talked with them earlier. They have also said that they are very happy that they are being provided with very essential items and food, and here is very good, and they have also greeted government of Assam and as well as the Red Cross Society for their help. With camera person Onup, this is Mridushmita for DD News India.
Amidst the corona crisis, this is for the first time in Tripura's history, the BJP IPFT government has decided to create posts of professor in 22 government degree colleges. Education Minister Ratan Lal Nath in a press conference at Civil Secretariat today said there was no post of professor in degree colleges in Tripura since their inception. With only post of assistant and associate professors, now the state government has decided to recruit professors. Nath briefed that there are total 115 associate professors in 22 government degree colleges, and only 10% among them will be recruited as professor based on their eligibility through Career Advance scheme. In addition, he also mentioned that the 30-bed COVID-19 health center has been introduced at Nursing Training Institute building of IGM Hospital. And that brings us to the end of this evening's bulletin. Thank you for tuning in. Namaskar.